You know, when we speak about the standards and the norms and the policies that are applied to healthcare facilities, we're actually very fortunate to benefit from the fact that the entire topic received a global call to action from the United Nations Secretary General back in 2018, and that resulted in a broadly endorsed global implementation plan led by the World Health Organization and UNICEF. And I feel that we just wanted to give an opportunity for that context, that global context, to be brought into the discussion. So I invite our colleague, Maggie Montgomery from WHO, to say a few words about the global plan and its relevance in the faith-based context.
Super. Thank you, Bud. And just to say, I'm feeling very inspired and very grateful for all of you and this opportunity. So I just want to thank you. I just wanted to bring a few things. I have a few documents, and I don't want to take them back with me. So if anybody wants hard copies, I will give them for free. Just very quickly, the Global Framework for Action, if you haven't had a look at it, please have a look. Many of you in this room or your organizations contributed to it. World Vision, CRS, UNC, Amory. It lays out very clearly what are the targets, right? And you can say, okay, the global targets, do they really matter? Probably in the village, no, right? But at the national level, at the regional level, and certainly at the global level, these targets do matter. They're now embedded in many of the global health strategies, and 5 years ago, that wasn't the case. So they're in the IPC global framework, they're in the high-level statement of AMR, they're in the standards and work around child and maternal health, and I'll say just a few things about that because it's really exciting to see more and more studies coming out, especially around maternal sepsis and newborn infections and WASH. So please have a look at this framework. The second thing, and a colleague pointed out to me, and it was not on purpose, but God works in mysterious ways, that it looks like Mother Mary is on the cover of our latest Global Progress Report. So this is a report that came out last year, and I really want to thank, in particular, Bud, because he talked about the Secretary General's call to action, which led to a UN General Assembly resolution in 2023, which mandates further that WHO and UNICEF need to regularly monitor and report on what's happening. And that monitoring is happening in two ways. So one is we're looking at services, and if you haven't gone to the washinfo.org site, I encourage you to do so because there's even sub-national data there. And I totally appreciate and applaud the effort to go beyond numbers, but the numbers do matter, right? And we've seen, especially at the national level, when governments wake up to the situation, they can't ignore it. So have a look. The latest data is going to be coming out in July. For the first time, we have global estimates for all 5 areas: water, sanitation, hand hygiene, cleaning, and I really appreciate some of the discussions about how do we encourage and professionally support all health workers, not just the ones providing care. Have a look at that data. The other piece of data that's in here, and it's been also come up, many of these actions are around the national actions, so around the system strengthening. And that's on the country tracker, which is on the website, which hopefully you've gone to go look at because it's on your QR code. But if you go to the main page on that website, and just to be clear, that site is meant to be a collective site. We purposely did not put branding on the front because we want this issue to be something that goes beyond any one partner, any one UN agency. So that data, looking at national standards, looking at national coordination mechanisms, looking at costed finance roadmaps is all there. We've done really well on the standard side, and a part of that is, I think, because of the WASH Fit. So this is the last document I'm going to show you. We've heard it come up a lot during the discussions, and just a few things to say that we have a whole package of resources. It's all freely available on WASH Fit. So if you go, again, to that site, which is on your QR code, you'll see it in all 5 UN languages. It's now in Ukrainian as well. We also have some open access online courses on WASH Fit, which if you go to the WHO Academy, these are jointly branded as well. So even though it's on the WHO site, it's done with UNICEF. We're about to launch an advanced healthcare waste course. And this course is super exciting. I've been involved in it. We have interactive tools. There's a bunch of videos because the waste issue in particular is coming up more and more. And I was happy to hear that question. So there's a whole slew of materials. And there's the basic issues, right, of segregation and how do you handle hazardous waste, but issues now around pharmaceutical waste, around mercury. So we go into a lot more detail about what you can do and what some of the emerging technologies are, especially on the treatment side. So really encourage you to have a look at that. I also just wanted to mention that on the leadership side, and again, this is driven in part by the UN General Assembly resolution, there should be an updated one coming out hopefully in the next few months that goes into much more details around some of the issues around equity, is the Global Strategic Network. Mary mentioned it as well. And this is a group of leaders from health, WASH, energy, and development who come together virtually twice a year to talk about, okay, what are the emerging trends? What do we need to do to shift mindsets and shift action at the global level and the regional and national level? The next meeting is the 7th of May. Tebaldo, I think, is not here at the moment, but we are hopeful that he can give a report back on this meeting and how we can talk more specifically about how we better engage, integrate all the work you're doing, both on the technical side, but on the leadership side, right? Because for us, it's both. You need a top-down and a bottom-up, and all of you, especially on the bottom-up side, I think have some really important lessons, engagement to share. Very quickly, okay, WHO commitments. We will continue to monitor the situation, to report through our global reporting and through our development of technical resources, and in particular, continue to engage with and change the mindsets of our health colleagues, right? Like, this is not finished yet. We need to make sure we talk about ownership. This is a health issue, right? And in particular, especially around maternal and newborn health, we've seen a stalling of maternal mortality figures for the past 15 years. I was just looking up the data. A woman is 60 times more likely to die during childbirth in Mali as she is in Italy, right? Like, that's horrendous. It shouldn't. Those inequities are huge, and we know that improving the cleanliness of our facilities, equipping midwives and nurses with the ability to deliver babies safely, is super important. On the WHO side as well, we will continue to obviously advocate government, right? And I realize in some ways it's really nice to have a safe space to talk outside government, but in order to scale, we need to increase our public investments. We know it's affordable. We've done the costing on it. We know it's a matter of prioritizing, and we know that the cost of inaction is high, as we've heard, but the cost of investing is actually not that great. So government will continue to be our main focal point, and certainly welcome the opportunity to encourage our country offices and, as a result, the ministers of health to make sure the faith-based organizations are part of those national task force, are sharing the data, are engaged in the activities. This is not meant to be an exclusive thing. We need everybody. Just lastly, about what's next, and I was really happy to read on the commitments page, and thank you all for all of you for submitting those, that many of them align with what we've already kind of signaled as well globally. Like, one, we have to reach the most vulnerable, right? It's just shocking. We still have so many people who are unserved, especially in sub-Saharan Africa. We need scalable, affordable models, right? So pilots are great, innovation is great, but if we can't afford to scale it, it doesn't make sense. And we also really appreciate the idea of incremental improvements. We can't go from 0 to 100 overnight, but if we can get to 40 and maybe to 60, we could probably get there. Also, we have to look at these emerging threats. We have issues around spread of AMR from sanitation systems. We have increase, for example, of Legionella and waterborne disease within our water systems. So we can't just meet the basics, right? We need, as we're making upgrades, as we're putting in new technologies, think about these other emerging threats, alongside, obviously, climate change and now, unfortunately, conflict. And some of those resilient issues for conflict and for climate overlap a lot. We have to embed in government systems, and we've talked a lot about that. We still only have something like 18% of countries who actively monitor WASH and healthcare facilities as part of health systems. Like, that has to change. We have to keep looking at emergencies, and I was really pleased to see so many people here who are working in emergency situations, right? We cannot ignore those situations, but it means we have to do things maybe differently, not as thoroughly, and we need to make sure they're part of the emergency health plans. And then the last thing is on the investments. And I've been really encouraged to hear some discussion about, yes, of course, we need to try to generate more resources, but how do we make better use of the resources that are already there? How do we engage governments, whether it's lifting taxes, whether it's getting paid to actually deliver services because the government can't reach it? I think are all important issues and financial mechanisms that we need to look for. Of course, we will still advocate to our donors and to our partners that they need to invest, but I think we need to start looking at these other avenues as well. Maybe just the last thing to say that another thing I took away from this was joy. And I hope that we all continue to address this issue with joy, because I think that's really important, especially as it links to the dignity and care. So thank you.
Maggie, thanks very much. And I want to highlight two particular aspects about this relationship that we have here with the World Health Organization, strengthening as it is even at this moment. Two things. One is that when you are making the case for the importance of standards and norms and protocols, et cetera, you can say with confidence that this is something that draws out of global action and is something that has been constructed in a careful way through the World Health Organization. So we do indeed have the standards and the norms and the protocols that we expect should exist in all of these facilities, faith-based and otherwise. And the other aspect is that when you, and we have heard this throughout the 2 days, when you hear people saying, well, but how do we reach the leadership? How do we really get to them? Well, it's the WHO that's speaking to the ministers of health and the public health systems, and we should utilize that. We should bring to the WHO the best examples that we have of the activities that the faith community is doing, and put them to work. So we'll see what we can do on that. Max, turning to you as our last speaker, you have a unique initiative in your partnership with Religions for Peace and the African Council of Religious Leaders. I'm looking forward to you telling us a little bit more about it. Again, I apologize that our RFP representative was unable to make it, but I know you will address the issue adequately and fully. Thank you, Max. Go ahead.
Thank you so much, Bud, and good afternoon. So my name is Max. I'm not a WASH expert nor a health expert, and I'm social and behavior change expert, so a social scientist, right? And it was actually very joyful to hear that there is a lot of expertise in the room on behavior change. Many of you refer to actually SBC, community engagement, participatory approaches during your presentation and when you were sharing your experiences. And that was first time that I don't have to advocate for that. Actually, the faith institutions are the most experts on doing behavior change since centuries. Usually I have to do it with colleagues like Maggie or colleagues like our WASH chiefs in UNICEF or our health chiefs. So that was very rewarding. Just to say that it was also great to hear from Maggie that actually this is a joint initiative, obviously, at global level. Lindsay, our colleagues, she's our WASH in healthcare facility specialist, could not attend, but I'm very grateful that she expanded the invitation to also bring our team to support this initiative globally. And UNICEF, beyond being part of these global commitments, defining standards, is also an implementer. So we have actually supported over 34,000 healthcare facilities with WASH services improvements in the last few years, many in collaboration with your organization, obviously, through partnership on the ground. But my intervention will be how we can actually leverage also our expertise on social and behavior change and community engagement to further scale what we do, not only at the FLCD side, but at the community side. And bringing more, again, increased motivation of actors, increasing participation, support from our communities on WASH-related behaviors. So first of all, maybe let's demystify what is SBC to those that maybe have not worked on our field. Well, we are trying to understand actually why people do what they do. That's our main focus, right? We try to understand why people behave in a certain way, and then we have to try to remove those barriers, because actually people don't necessarily need more information all the time. Sometimes it's an issue of information and knowledge, but in many instances, actually the barriers are either on the supply side, or maybe it's an issue of norms. If I do something, I will be sanctioned by the community, for example, or it might be an issue of lack of prioritization, and I don't have anybody role modeling those behaviors in my community, so I don't feel that I have to also act upon that. So based on our, again, programming across multiple areas, we have learned that if we put in place participatory approaches, we have an increased chance to actually produce social and behavior change. If we are doing positive role modeling, again, bringing the leaders to your faith leaders and speaking for these type of issues is going to actually create automatically some imitation and some actually modeling and increase the chances to actually produce change. We also need to develop different ways of triggering change. So community-led total sanitation is a proven solution that has been implemented not only at community level, but also in the institutions, right? And so we have that approach. Let's use it. Let's share it across all your network. And you can also become CLTS, let's say, partners, implementing partners, when UNICEF is pushing it for that with governments, with local governments, and so on. And also we are trying to replicate this idea of, again, social modeling and certification of community open defecation free at family level. So we also came up with a concept of model families in some countries where you are promoting a basket of behavior, including hygiene and sanitation related behaviors, and then there is a certification process to actually, again, elevating and give status to the families that are achieving that. And they're doing it basically with their own resources in many instances, right? And finally, in terms of principle, one that I think we haven't mentioned these 2 days is that the data that we are collecting at community level or at facility level, they don't have only to speak to decision makers, to managers of the health facilities, but need to speak back to the communities. If we have saved lives because we invested on hygiene, on wash at health facility level, let's use those data to create a dialogue with the communities. That's very powerful, actually, and it has been a key principle that we are trying to promote. Finally, now moving more into what we are doing in our institution and in partnership with the Legion for Peace. Since 2018, we actually realized that actually our country offices were already working with multiple faith partners. But it was a bit isolated and sometimes was a bit utilitaristic, if I may say so. We have a polio campaign, we need your support. Please do the promotion of the polio campaign. And that's it. And then we continue to work separately. So we try to come up with an initiative that could be interfaith, multi-partner, and it's called Faith for Positive Change for Children, Families and Communities. And since then, we actually work a lot on producing new guides, for example, for behavior change during COVID, so promoting behavioral behaviors that were key to prevent COVID, on immunization demand, on child marriage, female genital mutilation, and other topics. And now we would like to actually expand to wash and healthcare facilities. So that's one, producing guidelines for faith actors, but co-developed, not UNICEF coming in with from our side, from our offices, producing a guide and give it to you. On the contrary, let's co-design it, having the theologians reviewing the passages, ensuring that actually it speaks a little bit to what Ruth actually described this morning. So that's one. The other one, we also thought that it was important to develop a participatory approach for capacity building. And so we came up with a mind and heart dialogue capacity building package and a manual. Again, I heard the bishop actually mentioning about mind and heart this morning. So I think it was a very reasoning actually with what we have done. And this manual is actually available for you. It's agnostic. It can be used on any topic. But the idea is also to create faith literacy among the development actors as well. So not only us bringing, let's say, the science to faith actors, but also try to promote faith literacy among UNICEF staff, government staff, so that we can work more in equal terms. Again, it's a big endeavor, so I'm not saying that we have solved all the problems, but we're really trying to work together on this. And finally, also, we produce several, let's say, engagement that we call them faith and science conferences or faith and culture conferences on important topics, including obviously on COVAX, when we introduced COVAX a few years ago, but also on child marriage and FGM. And we organize these engagements with our faith partners. And we want to replicate that also on Wash and Healthcare Facility in Nairobi probably in Q3, and we're going to actually expand, I think, the organization committee, inviting, for example, colleagues from Matchup. I mentioned to Kata if she would be keen to support us with her team, and similarly other partners that might be interested, so that we can actually do this together, because you actually have more expertise than us on this particular field. So we are actually bringing more the SBC and community engagement science, but we will rely on you for all the work that has been done on washing healthcare facility. Finally, also, we have a lot of tools and guidance on SBC, on social and behavior change, that is actually available to any partner. We have a global guidance site, sbcguidance.org. I will share it through the organizer. That is actually available to any partner. We have a podcast. It's called ABC of SBC, so the basics of SBC, and we would like to also to offer the opportunity to create one podcast episode on the role of faith actors in Western healthcare facility, and I got permission from Lindsay to invest a little bit of the small resources that we have to do that. And finally, again, it could be nice also to produce a faith guide for this particular topic with all of you. So these are actually our commitments to bring Faith for Positive Change for Children initiative closer to these important goals that all of you and all of us have. Thank you.